Imagine discovering that your body has been sending small warnings for weeks, maybe months, and that these signals may indicate the beginning of a problem that millions of people only notice when it's already advanced. The truth is that early diabetes is usually discreet, almost invisible, and that's exactly why so many people only realize it when complications start to appear. Today, we're going to reveal these hidden signs and show how to identify them before they become something more serious. Stay alert, because what you're about to hear can literally change your relationship with your own health. And at the end of this topic, I'll invite you to stay with me, because in the next few minutes you'll see symptoms that many people confuse with simple day-to-day things, and that's where the danger lies. Before we move on, think for a moment about how small details can go unnoticed in your routine. That more intense thirst, that strange tiredness, all of this may have an important explanation. The goal of this video is to give you clarity without beating around the bush, so that you can identify these signs in a practical and direct way. Each topic was designed to guide you step by step, avoiding doubt and helping you understand what your body may be trying to say. So take a deep breath, because now we're going into content that can really make a difference. And get ready, because the next topic already reveals the first symptoms that almost no one notices, and that many people only discover too late. The first symptoms that no one notices, but that say a lot. When diabetes is just beginning, it usually manifests in an almost timid way, which is why so many people take a long time to notice it. The signs appear mixed into daily life: a slight change in appetite, a strange feeling of tiredness, a dryness in the mouth that you blame on the heat or on the fatigue of the day. These signs seem small, but they carry valuable information about how your body is dealing with glucose. Understanding these subtle symptoms is the first step to preventing the problem from progressing out of control. And it's precisely at this early stage that people get most confused, because everything seems normal, but little by little small patterns begin to repeat. When you learn to identify them, you gain the chance to act before more serious complications appear. That's why you should pay attention to these details that so many people ignore. Another important point is that, even though they are discreet, these signs do not appear by chance. They reveal that the body is working harder than it should to balance blood sugar levels. The good news is that, by recognizing these early alerts, it's possible to seek medical help quickly and make simple changes that can prevent greater damage. In the next topics, we're going to detail each symptom so that you know exactly what to look for in your daily life. If these signs already seem familiar to you or to someone you know, stay with me, because what comes next will make everything even clearer. Take a moment to like the video and subscribe to the channel to receive content that can help you take care of your health in a practical and direct way. Excessive thirst and constant urge to urinate, the early warning. Among the first signs that most often go unnoticed is excessive thirst, that dry mouth feeling that insists on showing up even when you've already had plenty of water. This happens because, with high blood sugar, the body tries to eliminate this excess through urine, making you go to the bathroom more often. It's a cycle that repeats itself. The more you urinate, the more your body asks for fluid replacement. Many people blame the heat, physical effort, or even aging, but in reality this may be one of the first alerts of early diabetes. Noticing this change in your hydration pattern is essential because it is usually one of the most consistent signs. If you notice that this thirst is not normal for you, or that your trips to the bathroom have increased with no apparent explanation, it's worth paying attention. Small changes like these can reveal a lot about how balanced your glucose is. In addition, this symptom usually comes along with a mild feeling of tiredness, since the body becomes overloaded trying to compensate for the imbalance. The key here is to observe repetition. It's not just one day of stronger thirst, but a trend that persists over the course of weeks. The earlier you identify this change, the sooner you can talk to a professional about simple tests that clarify the situation. In the next topics, you'll see how other signs complement this picture and help build the puzzle of early diabetes. Stay with me, because understanding the next symptom may connect all of this and make it even clearer what your body is trying to say. Unexplained tiredness, when the body tries to warn you. Constant tiredness is one of those tricky symptoms that many people simply accept as part of daily life. However, when this fatigue appears even after a good night's sleep or on days when you haven't made any effort at all, it may be revealing something important. When glucose doesn't properly enter the cells, the body runs out of energy, and this causes persistent fatigue, that feeling of heaviness in the body and lack of motivation. It's the kind of symptom people tend to ignore, but it can be one of the first signs that something is not right. Observing this tiredness critically is essential. It doesn't appear out of nowhere, but grows slowly, almost silently. That's why so many people confuse it with stress, age, or poor sleep. But in the case of early diabetes, this fatigue comes directly from the body's difficulty in turning glucose into fuel. This type of tiredness also interferes with mood, the ability to concentrate, and even physical strength. It makes simple tasks take longer and makes a person feel less productive throughout the day. However, when you understand that this may be the body's reaction to glucose imbalance, you start to look at the situation with much more attention. The point here is to notice when this pattern repeats and doesn't go away with rest. And the next topic will deepen this puzzle even more, revealing a symptom that many people associate only with aging, but that may indicate something very different. Vision changes, the symptom many people ignore. One of the signs that most confuse people at the beginning of diabetes is blurry vision. That sudden difficulty seeing clearly that appears and disappears without explanation. This happens because, when there is excess glucose in the blood, the body retains more fluid, including inside the eye's lens, altering its curvature and impairing focus. Many people think it's just eye strain, age, or too much reading, but this change may be a direct message from the body asking for attention. It's important to notice how often this happens. If you realize that your vision becomes blurry at certain times of the day, especially after eating, this may indicate that your glucose levels are fluctuating more than they should. Small repeated episodes over the course of weeks deserve a closer look. Another essential point is that these changes do not necessarily mean that there has been permanent eye damage. Many times, they happen because the body is trying to rebalance itself in the face of excess circulating sugar. However, ignoring these signs for too long can lead to real complications in the future, such as diabetic retinopathy. That's why recognizing this change in vision early is a huge advantage in prevention. And now that you know how these visual signs can reveal the beginning of diabetes, stay with me, because in the next topic you'll understand a symptom that almost always goes unnoticed, and that often appears even before vision begins to change. Take a moment to like the video and subscribe to the channel. This helps a lot to bring quality information to more people. Tingling and loss of sensation, a warning touch. Tingling in the hands and feet is one of those signs that many people ignore, thinking it's just poor circulation or a bad sleeping position. However, when it starts to appear frequently, especially at times of rest, it may indicate that the nerves are being affected by excess glucose in the blood. This change happens because peripheral nerves are extremely sensitive to sugar fluctuations, and early diabetes can already begin to cause small irritations in these fibers. It is a silent, gradual, and very common symptom, but also one of the most important to notice early. Observing when this tingling appears, how long it lasts, and whether it repeats throughout the week can offer valuable clues about what is happening inside the body. In addition to tingling, some people report a loss of sensation, as if the skin were numb in certain spots. This happens because, over time, excess glucose can impair communication between the nerves and the brain, generating a strange sensation different from normal. The important thing here is to notice the change, something that didn't exist before and starts to repeat, indicating that there is an imbalance that deserves attention. And this symptom is directly connected to what we'll see in the next topic, where the body begins to send another type of signal that many people interpret incorrectly, and that can complete the alert your nerves are already giving. Unusual hunger. What this reveals about your glucose. When diabetes is in its early stage, it's common to feel more intense hunger than usual, even right after a meal. This happens because, despite having glucose circulating in the blood, it is not properly entering the cells to generate energy. The body then interprets this lack of energy as lack of food and responds by increasing appetite. Many people think it's just anxiety, a hectic routine, or a natural increase in hunger, but this out-of-pattern hunger may be an important warning sign. Paying attention to this behavior is essential. It's not just eating more, but feeling that hunger doesn't go away, that it comes back quickly and seems disproportionate to what you've eaten. This pattern may show that the body is trying to compensate for an energy imbalance caused by insulin resistance. Another important aspect is that this increased hunger usually comes along with a feeling of weakness or irritability when a person goes a few hours without eating. This occurs because glucose levels are unstable, making it difficult for the body to maintain constant energy. This cycle of intense hunger and energy dips is a very valuable indicator of early diabetes, and understanding it can help you anticipate the diagnosis. And the next topic will tie all of this together with one of the most obvious signs, which, paradoxically, many people only notice when it's already advanced. Don't miss it, because it can be decisive for understanding what is happening in your body. Unexplained weight loss, when the body sends strong signals. Sudden weight loss, even when you haven't changed anything in your diet or routine, is one of the most striking signs of early diabetes. This happens because, without being able to use glucose as an energy source, the body starts burning fat and even muscle mass to compensate. The result is accelerated weight loss, which often even seems positive, but is actually a clear warning that something is not working as it should. This type of weight loss usually comes along with tiredness and a greater feeling of weakness. It is important to observe the speed and consistency of this weight loss. When the body begins to lose nutrients in an uncontrolled way, this indicates that the metabolism is trying to adapt to a situation of imbalance. If your clothes start to feel loose without any effort, it's time to pay more attention to the other symptoms we've already mentioned. In addition, this weight loss may come with changes in eating habits, such as excessive hunger or a feeling of an always empty stomach. This happens because the body is trying to compensate for the lack of available energy in the cells. Recognizing this symptom early can help avoid complications and encourage you to seek medical guidance before the condition progresses. And now that you already understand how this unexpected weight loss fits into the set of signs, stay with me, because the next topic shows a pattern that many people ignore, but that can be decisive for identifying early diabetes. Take a moment to like the video and subscribe to the channel. This helps a lot to bring clear and reliable health information to more people. Frequent infections, the pattern that should not be ignored. When diabetes is in its early stage, the body begins to have more difficulty fighting microorganisms, and this makes infections appear more often. Repeated urinary infections, recurrent candidiasis, and even small skin inflammations that take a long time to improve may be signs that something is out of balance. This happens because excess glucose in the blood creates a more favorable environment for fungi and bacteria to proliferate. Many people associate these infections with the weather, stress, or low immunity, but they can be an early warning of diabetes. It is essential to observe when these infections begin to become a pattern. It's not just an isolated event, but episodes that happen at increasingly shorter intervals. This repetition shows that the body is having difficulty defending itself, and this may be directly related to glucose imbalance. Another important point is that these infections usually come along with other symptoms already mentioned in the previous topics, such as tiredness, excessive thirst, or vision changes. When several of these signs appear together, attention needs to be redoubled. Even simple infections can become persistent, and this resistance to treatment is a valuable indicator. In the next topic, we're going to delve into one of the most evident signs, one that often closes the alert cycle: difficulty healing. It is directly connected to what you've just heard and can further clarify the overall picture. Slow healing. What this indicates about your health. When small wounds begin to take longer than normal to heal, this may be one of the clearest signs that the body is dealing with elevated glucose levels. Excess sugar harms circulation and makes it difficult to transport essential nutrients for skin regeneration. This causes simple cuts, scratches, and even small wounds to take days or even weeks to improve. Many people attribute this slow healing to age or fragile skin, but it may be an early indicator of diabetes. Observing this change in healing time is fundamental. It is not just about one wound or another, but about a repeated pattern in which the body no longer reacts as it did before. This behavior reveals that metabolism is not functioning in a balanced way, harming the natural repair process. In addition, slow healing may come along with inflammations that insist on coming back or with red areas that never seem to fully improve. This happens because high glucose directly interferes with blood vessel function, weakening the local defense system. The earlier this change is noticed, the greater the chance of acting before serious complications set in. And this symptom leads us directly to the next topic, where we're going to talk about one of the most important steps: identifying the right moment to seek medical help. This knowledge can make all the difference in diagnosing and preventing bigger problems. When to seek medical help, the right moment to act. Recognizing the signs is essential, but knowing when to look for a professional is even more important. When two or more of the symptoms we've mentioned begin to appear together, such as intense thirst, frequent tiredness, blurry vision, or recurrent infections, this is already a strong indication that something needs to be evaluated more carefully. Early diabetes often goes unnoticed precisely because people wait for the symptoms to get stronger, but the ideal is to act before that happens. Simple tests, such as fasting blood glucose or the HbA1c, glycated hemoglobin test, can quickly bring clarity. Seeking medical help at this point doesn't mean you already have a definitive diagnosis, but that you are taking a preventive and smart approach. The earlier professional guidance happens, the greater the chances of controlling the problem with adjustments in diet, physical activity, and small lifestyle changes. In addition, only a doctor can accurately assess whether the symptoms are directly related to diabetes or to another condition that also deserves attention. Another key point is not to wait for the condition to get worse before taking action. Many people delay seeking help out of fear, lack of information, or because they believe the symptoms will go away on their own. However, acting early is exactly what brings the best results. When you talk to a professional at the beginning, you avoid major complications, preserve your quality of life, and receive personalized guidance. And now that you already know how to identify the ideal moment to seek help, stay with me, because in the next topic we're going to tie all of this together in a practical, clear, and direct conclusion, something that can transform your relationship with your own health. Take a moment to like the video and subscribe to the channel. This helps us continue bringing essential content for your well-being. How to protect yourself and live more safely. Now that you know the main signs of early diabetes, it becomes much easier to notice when the body is trying to send a warning. Each symptom we discussed, from excessive thirst to slow healing, works as an important piece in a puzzle that reveals how your metabolic balance is doing. The great advantage of recognizing these signs early is being able to act before the problem progresses, seeking a professional evaluation and adopting habits that help control glucose. Information is power, and when you understand what is happening, you make safer decisions for your health. It's essential to remember that diabetes, when identified early, offers far more possibilities for control and prevention. It's not about living in fear, but about living with awareness. Small changes in your daily life, such as adjusting your diet, increasing physical activity, and having regular checkups, can completely transform the future of your health. The more attentive you are to the signs, the more prepared you'll be to avoid complications and preserve your quality of life. And the final message is simple. Take care of your body today so that it can continue taking care of you tomorrow. Don't ignore signs that seem small. They can be powerful allies in prevention. By adopting this mindset, you put your health first and gain more peace of mind to enjoy life with safety and autonomy. If this content was useful to you, share it with someone who can also benefit from this information, and follow the channel to keep receiving practical and valuable guidance about health. I'm here to help you whenever you need it.